Voice down.
Hello. Welcome to the comeback seat. Now we're really in the picture.
We are.
Ben, welcome to the comeback seat. Thank you for being here. And tell us a little bit about yourself.
I'm an occupational therapist here in town, specializing in postural restoration and applied integration academies treatment technique out of Salem, Oregon. So, yeah.
Awesome. Can you do me a huge favor? I forgot about this path. Yeah.
Where do you want?
You guys just put it over there. Thank you. Man, how I know about men is that when I went through my situation almost 5 years ago, I was told, go and see men, go and see men. Well, men did not take my insurance and I couldn't see men, but you are pretty dang popular here in town.
And we got a lot of mutual friends.
Yes, we do. A lot of my co-hosts are your friends too.
Yeah.
And one of them, Steve, my personal trainer, said, you have to go see men. And I did call a few times and harass the receptionist, but I never got in to see men, which is his loss. I'm just kidding.
Hey, it is my loss.
Men, an occupational therapist, can you tell our listeners what the difference is between you and a physical therapist? And yeah, go ahead.
You know, in terms of scope of practice, it really depends on which area of practice you're in. In short, occupational therapists are more driven towards restoration of ADLs, modification, so that the patient can complete their activity of daily living with efficiency, with the return ability to complete their activity of daily living. Our training is slightly different from that of physical therapy. But to be honest, I am an occupational therapist, but I spent all of my career dedicating my craft to postural restoration and understanding the body's mechanic and the asymmetries. Mm-hmm. It is a field of practice that is not particularly isolated to physical therapy or occupational therapy. It's a science on its own.
Yeah.
And I think it was created that way so that it's not limited in terms of which profession can perform the necessary science.
Yeah.
So I'm one of the very few, I'm one of two occupational therapists that are certified in postural restoration in the world. As far as I know, it's only myself and one other occupational therapist out of Minnesota. And all of the other 300 something certified therapists are physical therapists.
I'll ask Chat later and challenge that. I'll Google it. I should be able to Google it right.
There you go.
I believe you.
And, you know, if you go on postural restoration website, every certified therapist has their picture on there. And once in a while, I get a therapist I know that goes through certification process and they take a picture of my headshot.
Yeah.
And it's one of the funniest headshots you ever see because back when everyone was going to certification, I went to certification when I was just graduated from grad school, so I didn't have any money to get a headshot.
Yeah.
So I literally cropped a picture someone took of me at a wedding, and I used that as my
God
as my headshot. So you have these 300 some professional headshots, and then there's one of me just like looking smug,
looking creepy in a way.
Looking creepy, yeah. I don't want to
That's what we could have put on. We could have gotten a ton of views. You mentioned that you went to school in Omaha. How long? I mean, when we were talking off script, but how long were you in Omaha for?
I was in Omaha for about 5.5 years.
So schooling was only 5.5 years? Or?
So after I got my bachelor from Hawaii University, I ended up at Creighton University, got my doctorate in occupational therapy. That was a 3.5 year process.
Okay.
And then I stayed in Omaha, worked in Omaha, tried to learn as much as I possibly can from the Postural Restoration Institute and my mentor, James Anderson. I stayed and I worked as long as I could before I had to move back to Oregon to be with family.
Yeah. So how long in total school then between the two schools?
So it's really hard to break it down because you have 4 years of undergrad, 3.5 years of the doctorate level program, and then technically it's supposed to be 3 to 5 years of postgraduate.
Yeah.
learning in order to get certified as a postural restoration certified therapist, but I started that process while I was in school. So I was going to grad school and I was learning to get certified at the same time.
Wow.
So I combined that whole process, and it took me about 9-10 years.
Awesome. That's a long time.
It's a long time to be dedicated to school, but
Did you work full time too?
so going to graduate school, the first year of grad school, I had 3 part-time jobs.
Okay.
And then second year, I was down to 2 part-time jobs. And by the time I got to third year, the last year of graduate school, I was down to just 1 part-time. Actually, no, I kept my 2 part-time jobs. I waited tables and I worked in front of fitness, and then doing all my schooling.
Wow, that's like good for you. I had a guest on my podcast named Josh Grossman, and he, of course, you did your whole look at him and they thought I can help you, and you did a tremendous job. What do you look at? Why is it that you're so you could cue in on someone and I don't know what the right question or right word, but they were going somewhere else. They ended up with you, and you improved his body within the first couple of weeks, where he had been trying to go to physical therapy for a couple months. What's different from you compared to other?
I mean, where do I even start? Posture restoration allows me to look at human movement and identify a dysfunctional movement pattern, and from that dysfunctional movement pattern, you start identifying muscles that are responsible for that dysfunctional movement pattern. How can you take that one human being out of that pattern? What muscle necessary, which planes of movement? So it gets really technical, but the easiest way to explain it is that I don't subscribe to a protocol. I subscribe to the principles. And I think that's how postural restoration and applied integration really changed the way that I look at a patient clinically.
Mm-hmm.
We don't necessarily follow strict protocol. We follow principles that guide us into treating the patient in a direction that they need to be guided to take them out of that dysfunctional movement pattern. So traditional therapy is very protocol driven. You do this week 1, you do this week 2, you do this with this injury, and they follow strict protocol. And in Josh's case, they follow strict protocol, and those protocols were outdated and not specific enough for his purpose of returning to sport. And
Because he was being treated as a 70-year-old?
Well, that was a slight exaggeration, but those protocols wouldn't necessarily. There's not a lot of deviation from the protocol between someone like Josh's age and his goals and someone who is in their 40s and their goals.
Yeah.
There has to be a delineation between those two, and traditional approaches doesn't allow for a lot of room if you're following strict protocol to treat someone like Josh. So
how long does it take you to look at someone, to evaluate them, and come up with your own plan? Are you constantly, is your head constantly going, and if you saw me walking through a gym, would you like Terminator?
I do. My brain probably make those sound effects as I assess someone, but no, the assessment starts as soon as I shake your hand, I watch you walk, I watch you move, watch how you get up from the chair. At my clinic, I use chairs without armrests for a reason. I use lower chair for a reason, so that I can see how people get up out of a chair. I can see people, and that starts with the very first visit, right? I come out to the waiting room, call your name, I watch you get up from the chair, I watch how you walk into the treatment room. All of that little movement means more to me than the actual objective assessment, because it allows me to watch how you move without me assessing you, without knowing that someone is assessing you. I do the whole objective movement, and then we'll go through the whole treatment, and then we'll do a retest and see what needs to be progressed. So the evaluation, the assessment starts from the very first second I call your name.
Yeah.
Yeah.
Well, what are some red flags that you could tell us? Like, if I were to go and have to look through and find a physical therapist, which I had to do, and it is hard. I mean, obviously, insurance played a big role in my decision, but even with the people that did take my insurance, after the fact, after I went there, you know, you're messing with someone's life for at least 3-4 months, or it could be 3-4 years. But what are some red flags that, do you know of any red flags that you would turn around and walk out the door?
I'm not necessarily certain things I look for in general practitioners,
Yes.
not just physical therapists, but physicians,
Yes.
surgeons. I look for someone who can hold a conversation at my level. That's the very first thing.
That's a good point.
If you can build rapport, if you care about your patient, then if you have good rapport, you're gonna make better progress. That's one. Two, I look for practitioners who care more about the patient than the protocol. That's probably my number one thing. If you go to any commercialized physical therapy clinic, it's 16 to 22 patients a day for a PT. They'll meet you for the first 15, 30 minutes. They'll do their assessment. They'll pass you on to a therapy assistant, a therapy aide, and they don't see you again for the next 4 or 6 visit. And then it could be with a different physical therapist who takes the measurement and reassess you. Those protocols and those advancement in traditional physical therapy is how they run a successful business,
Sure.
but it's not necessarily the most optimal for patient getting better.
Yeah.
So it's optimal for business, not necessarily optimal for care. And, you know, you're going to get me started on the whole healthcare industry, because the industry itself is a very provider driven. So traditional physical therapy, they go out, they do a lot of marketing to doctors, and they try to get referral from doctors and surgeons. And not a lot of it comes from the patient. Healthcare should be coming from a patient driven atmosphere. So if I treated Steve well and I tried to learn from Steve, and Steve knows what I do, he's going to tell you, hey, you need to go to MINH, because that comes more from a patient-driven system versus you going to your doctor and your doctor says, well, you're just going to go to your physical therapist closest to your house, because all physical therapy, all rehab are the same. It's not.
No.
And that's the assumption that most patients make, is that it doesn't matter where I go for rehab, it's all the same.
Yeah.
You know, I was watching a clip this morning on Instagram, and they talk about how you can go to 6 different physical therapists, and all 6 physical therapists will have 6 different opinions, 6 different diagnoses, and 6 different approaches to treat you. How do you know which one is going to be the best? And that's the thing, you don't.
Mm-hmm.
I only know what I do in terms of posture restoration and applied integration. So I'm constantly seeking to learn new advancement in not only in posture restoration and applied integration, but I'm learning from people like Steve.
Yeah.
He has years and years of knowledge and training.
Sure.
I'm constantly trying to learn from Shasta, because there is no disintegration between what the psychological mind does versus the physical body does. It's one. Right?
Yeah.
So I'm constantly trying to learn more about EMDR or somatic experiencing or different approaches, and how that can contribute to how I approach a patient, how I talk to a patient. Constantly learning from my business partner, Matthew Bailey, who owns a chiropractic office right next to me. Constantly learning from him, who owns a training facility here in town, Resilient Human Performance. So surrounding myself with different professions,
Sure.
Learning from different professions. You know, I can talk about V2 dentistry and how Brian Van Boris was my mentor, teaching me about bite pattern, and I work with Dr. Stroud and Eugene, and he has helped me collaborate and fix a lot of patients based on dysfunctional bite pattern, and how bite pattern and how teeth affects posture, and how teeth affects the feet.
Wow.
You know, Dr. Jessica Bonner, who uses vision to change posture, to change how you interact with the ground, to change how you interact with your physical space. So a lot of people don't understand that physical therapy is a very, very, very small percent of what the human body can do. Neurologically, physical rehab is just a small fraction of what the human body can do. You have to integrate all of the other professions into helping the human body interact with its environment to alleviate that dysfunction.
Well, and I think you said a big one. You're constantly seeking and learning. You're constantly seeking and learning. You're constantly seeking and learning. And to me, a lot of them, and I speak with respect, a lot of them are just set with, okay, we learned that in college. I'm done. I maybe do educational classes each year, but I would take videos when I was in inpatient rehab, and I would take the videos from Florida. There was a place that I called in Florida. And the girl and I were both on the same level, same diagnosis, and she was paralyzed as well from the neck down. And what they were doing with her, because she posts videos, and what I was doing were not even matching up, not even close. And I really wanted to be pushed. I wanted to be pushed because I was depressed. I wanted to get out of this. I didn't want to. This was not my life. This was not my path. I was thinking these were the things that were going on. So I would literally take the videos, and they would just kind of, well, they were real hesitant, or they didn't have the tools, or whatever. But the really good ones would adjust and watch the video and figure it out. I do that quite a bit with my occupational therapist, but she's very good anyways. But together we come up with this. She'll watch my video and she'll alter it. And it's like awesome,
The hardest thing about healthcare is ego. And especially coming from a profession that's developing its reputation into a doctorate level program, right? So you have doctor of physical therapy, doctor of occupational therapy, and the medical schooling teaches you that, with that doctorate title comes certain responsibility of you upholding this reputation of being a doctorate level program. That's one reason why, even though I have a doctorate level degree, all of my patients, all of my friends just call me by my first name. I don't subscribe to the egocentric type of practice. Because, I will admit I don't know what I don't know. If a patient comes to me and they're asked, hey, what about this treatment technique? And if it's something I've never seen, I'm going to be like, whoa, I've never seen that. Let me go and learn about it a little bit more. If it's something that I've seen and I have my own bias, I'm like, I've done that before. It hasn't worked. But if you want to try, I may know someone who does that better than I do, and I'll send them there. But if you remove that egocentric type of practice, it makes your life a whole lot easier, and the patient actually have a lot more respect for you, understanding that you have their best interests at heart versus doing what you do. With all ego, you have to go, why doctor this stuff?
My friend, he had a stroke, and he called you out, and you did significant work with him. He thought he would never be able to drive, and one of his hobbies is his Mustangs. He has all of them named, everything. And I believe he is driving. I've seen him, but he's driving, and he did really good work with him. And I just applaud you, because I was just thinking that one. I didn't want to forget about that. But anyway, so you, I think you're right. You have to take ego out of it and just listen to your patients. And then also going back to your red flags, well, not really red flags, but being genuine. Being genuine is the key thing too. I think that a lot of times everyone's just another number. Get out, get in, out, and just be genuine and listen to the patient. Now, you went from working at a clinic to owning your own. How is that? What's that like?
That whole process was all fate. I believe in fate. It was meant to happen. I had a business partner. We opened a clinic that didn't work out. And it was a bad separation at first. I opened my clinic, and I sat down and I thought about the whole process. I opened my clinic in 2013, and in 2015, I actually wrote a thank you card to him. I sent it to him, and I thank him for allowing me to go through this whole process and separation and reclosing of the clinic was meant to be. And I thank him for bringing postural restoration into the Salem community and allowing me to host classes. No hard feelings, it is what it is. I don't believe in holding a lot of that resentment. It's just toxic.
Yes.
So, I want to thank you, Carter. Actually, last month, they hosted a class. I came to the class, helped out the class. And we talked and we shook hands. That whole process has been very rewarding.
Yeah.
On its own, and opening a clinic and having my wife be running the clinic, be the bookkeeper, and help me run the clinic is probably the best thing I've done in my career.
I wonder if I could get the back door and she could just write my name in there and take it from I need to talk to your wife. That's what I do.
She does. She is the boss. She does control everything. The clinical aspect.
Yes. Now tell us about your new baby, the hyperbaric chamber. Tell us about.
It's a new venture that my business partner and I decided to start. It's a wellness driven hyperbaric chamber. It's a heart shop hyperbaric chamber. The evolution of medicine is moving so fast. And, the use of peptides. We talked about stem cell. We talked about red light therapy, laser therapy, all that stuff. Out of all of the treatment modalities for biohacking, it seems like the oldest treatment for biohacking and the most research is the use of a hyperbaric chamber. So that's one reason why we decided to start with the hyperbaric chamber business, because you can find so many research studies on how hyperbaric chamber would help nerve regeneration and tissue healing. Every major burn unit in the country uses hyperbaric chamber for healing. So it's been around since, I want to say it's the 70s, but I'm sure it's actually even earlier than that. We decided to start that business, and we'll see where it takes us.
Yeah. Now, I tried it, and I love it, and I'll tell you what. I want to know what the difference is with the two ones that are on the floor that are fabric, and then you talked about a hard shell. What's the difference between the two?
So there's actually several types of hyperbaric chamber. There's a soft shell hyperbaric chamber. Those are usually plastic PVC inflatables, and they go up to 1.5 atmosphere pressure. Our chamber is hard shell. It's 2,000 pounds. I had to reinforce the floor. It took us 2 days to get it there and about 12 months to have it delivered.
Jeez.
It goes up to 2.0 ATA, which is, I think, the highest you can go without using gaseous oxygen for compression. So it's the risk for combustion is a lot less because you're pressurizing with air versus gaseous oxygen. And then we have the highest level of hyperbaric chambers, which is the medical grade hyperbaric chamber that uses gaseous oxygen, and that you can go up to, I think, 4 or 5 ATA, and you can do all kinds of stuff with that. But
so as a what's the difference with benefits as if I were to go into the soft shell versus the hard shell with the higher atmosphere? Yeah.
It minimizes and shrinks the oxygen particles the higher you go up into pressure. Delivery of oxygen gets better as you go up in higher pressure. A lot of the research has shown anywhere between 1.5 to 2.0 is good for regeneration and healing. You need to go up much higher, like 3 or 4 if you're doing a lot of burn type of rehab.
That would be at a wound center.
That would be at a wound center.
Yeah, I asked my neurologist because I found a couple. There was a medical grade one in McMinnville and one in Albany, and it said there was one in Salem. Going down a little there is no one in Salem supposedly, unless they have it hidden for the wound. But she had no idea what a hyperbaric chamber is, and it was my neurologist, and I found that intriguing. And I was not the way the coding was. I could not get into the McMinnville one because I didn't have the wound, like you said. But I did try the soft shell. I went to Lake Oswego because I don't know where Salem has, now you do, but I didn't know where to go with Salem. And then, but they closed. It was a restore. It was like a membership type place. But then I tried yours. Let me tell you what, the difference with getting in a soft shell versus the hard shell, what an amazing, I mean, it was like luxury. It was like I was going to take off. I haven't posted the picture because I was waiting for our podcast, but I had Henry here help. I don't know his title, sorry. Henry?
Henry, he runs the whole program.
Okay, Dr. Henry.
No, just Henry. No, Henry runs all our scheduling, setting up the machine, all
He's
that.
so sweet.
Yeah.
He said you got him from Lowe's. He said come on over.
Well, it's more than that. I know Henry. Henry was really good too basketball as well. But I know his mom. I know his dad.
Yeah.
For a long time, and he's a good kid. So I want to be able to have him be a part of the project.
Oh, he's so passionate about it.
He's very passionate about it.
He definitely learned everything about whatever you guys did. Everything.
And that's one of the biggest advantages of hiring things.
Yeah.
Right? Is because Henry doesn't know this, but I actually talked to his mom before I hired him. And she asked me, why do I want to hire Henry? And I said, because of his ambition. When you're hiring a 20-something-year-old, with direction, I know that he's ambitious, and I know he wants the program to be as successful as possible. I know he's going to want to do everything as needed to make it successful. And so far, he has. He's doing everything to keep the program going and to keep the program successful. And we spent a lot of money on this chamber.
Oh, I'm sure.
Because within the hard shell chamber, you can have a laying down chamber or you can have a sitting up chamber. And the difference between a sitting down chamber and a sitting up chamber and a laying down chamber is significant. So, Matt and I were like, if we're going to do this, we'll do it right.
Yeah, you're going to invest.
So we spent a little bit more than we would like, but at the end of the day, if it helps, if people have access to it,
And we need that. We need that.
we need something like that in the city.
Yeah. We're the capital of Oregon. We should have this, dang it.
And as far as I know, this is the only solid hard shell chamber that we have here in the city.
And it's a little recliner, and it's like you're going to take off in a spaceship. It's so comfortable.
It's actually the size of a smart car.
Is it?
it's 2,000 pounds with a recliner in it, so yeah, it feels like you're sitting in a car. Really.
Yeah, and you have a little table. It's almost like you're going first class somewhere, but
and strategically, there's windows on both sides, and you can open the window as well. So if you're claustrophobic, you can look outside, you can see people walking.
Yeah.
We can open the window.
It was super comfortable.
Yep, there's natural lighting.
Yeah, and Henry was available for any questions that I needed, and it was. So, who's the ideal candidate for the hyperbaric chamber? Besides myself.
It's geared more towards wellness. I have to be really careful and not promise any significant results. That's directly, you're going to do this, and this is going to heal you. So I'm going to refrain from answering that question.
Okay.
Say, if you think the hyperbaric chamber can help you, do some basic research, do some Google research. We've had, right now we've had patients going through it in complement with going through chemotherapy. Mm-hmm. We have patients from every generation. We have patients going through it for tissue healing. We have patients going through for general wellness, post surgery recovery. So we have a variety of people going through it for wellness reasons.
Yeah. Well, that's awesome, and I'm glad you opened it up, and I'm glad you were have the perfect person for it. And I will put a link with our podcast today about the hyperbaric chamber. I'm an advocate for it. And anything else you would like to share with our listeners today? What are your goals?
My goal is to work until the day I die. I know that sounds funny because a few years ago I was asked by the physical therapist here in town, why don't I expand my clinic? That's one of the things that most people I get asked the most. Why don't I expand my clinic? Why don't I have more practitioners in? Why don't I make the clinic bigger, more accessible? And the other question is, why don't I go just cash pay only? And there's a lot of reasons for that. I don't want to expand my clinic because I love what I do and I love patient care. I'm not in it for the money of making billions of dollars and then retire early. If I win the lottery today, I'd still be at work tomorrow, just because I love patient care and I love the art of understanding the human body and the human mind and how I can progress in that craft. Right? That's one. Two, I have I don't want to go cash pay. I know that's the newer model. That's a lot of therapists in town go cash pay. I started in 2013, 13 years ago when I opened the clinic. I set my price at $120 per visit. It's been 13 years and I still haven't raised my price because I believe in trying to help as many people as possible while maintaining a business. That's a really hard balance. That's one reason why I don't accept your insurance, right? Yeah. Because certain insurance, it would be a huge loss. And finding that moral and that ethical balance between how much do I make and do I make enough to sustain a business, that's been a battle. But I still take insurance. I take most major insurance, and I haven't raised my cash pay price yet as of today. But who knows? Because the economy is doing all kinds of crazy stuff. But that's one reason why is I want to help as many people as possible, not just the people who can afford me. Yeah. At $120 per visit right now, it's still less than most massage therapists.
Well, I didn't know you had a cash pay option. Yeah. Well, I'll be talking to my stepdad later on today. Man, you're awesome. And, oops. Excuse us while I fix this microphone. That we're not talking into, but I was going to fix it for me. Well, thank you so much for taking the time out today. You've been awesome. And I know so many people talk highly about you. And do you really know how important you are to Salem, Oregon? Do you really know that you're an excellent I'll use that word physical therapist, but what I mean is occupational therapist, posture.
Yeah, I try to fly under the radar as much as possible because a lot of people ask me like, "Hey, do you have a business card?" I never carry a business card. I mean, I try to fly under the radar as much as possible because I try to keep this as most patient-centered as possible. I'm not out there to market myself. If you've had a good experience and if I was able to help you, you're going to tell your friends. So it's all based on word of mouth. It's probably the worst business model you can have, but it's also the best business model you can have. Because Salem, even though it's growing, it's big, but yet it's still very small at the same time.
That's true.
So I appreciate everyone who has helped me be where I am today, and we'll see where it goes.
Well, and I'm going to market as much as I possibly can in the Hyperbaric chamber because I'm a firm believer in it, and it's another tool in the toolbox for people to get better and improve their lives. Right? That's what we want.
And I want to throw this out there. Any physical therapist that's watching this podcast, I'm not putting down the profession. I'm not putting down anybody. It's just what I do is very different. I don't want to compare myself to physical therapy. Postural restoration itself is a whole separate science. Yeah. Yeah. And I hope I didn't put in anyone. I do love my physical therapist. He takes my insurance and he's amazing. Brady, I love you. And there are good people. Just like there was a plastic surgeon that just did a TED Talk, or I don't know what it was, but he was saying there's good plastic surgeons and there's ones that are not good. It's just, it is what it is. There's good cooks, there's bad cooks. It's just a profession that, not all plastic surgeons are bad. Not all physical therapists are bad. Not all occupational therapists. They're all just, I get what you're saying. And I'm not putting down anyone. It's just, I think that there needs to be more of a creative side on the therapy. I think there needs to be a lot less ego. I think there needs to be a lot more curiosity in terms of learning and expanding your field of practice. Yeah. Right? And I think most physical therapists can agree. I a friend who just graduated physical therapy school, and I think he's going to be one of the more successful physical therapists. He's not here in town. He's out of Forest Grove, but one of the smartest guys I know. He worked as a strength and conditioning coach and trainer for, I don't know, 5 or 6 years before becoming a physical therapist. So his field of practice is going to be very wide, and he's young enough to be ambitious. Yeah, so I'm excited to see people like that in physical therapy and in physical medicine.
Sure.
I think those are the people that's going to change the trajectory of where physical medicine can go.
Yeah.
So yeah, I'm excited about all that, all of the changes.
Yeah.
That I see.
And when you said you did a class, what are the classes that you do?
So Postural Restoration just hosted a course on restoration here in Salem, Oregon. I think they have another course here in October. We were one of the very first city that hosted the Applied Integration Academies course on Gates and grounding, taught by James Anderson and Mike Cantrell. Those two have been my mentor, but specifically James. James is still my mentor to this day. James is the person who taught me everything I know until this day.
Where's James based out of?
James is based, I know he lives in St. George, Utah. So he's based out of Utah.
Okay.
And, I give all the credit to both James and Ron Huruska, because both of those people knew how passionate I am about physical medicine, rehab, and how broke I was as a student in a graduate program. And they both have helped me progress this trajectory of being where I am today.
That's awesome.
Yeah.
That's awesome. Min, I appreciate your time, and I look forward to seeing you for my cash pay. And there you have it. You can call him Min. He's genuine, he's nice, he's friendly, and I'm honest.
Smartest, but
He's a smart ass, yes. So am I.